We
have the quorum for the meeting, and this is the appointed time. Welcome to the Public Works Subcommittee meeting this morning. In the legislative year 2017-18, as of the last meeting, we have approved 22 projects with a total commitment of $34.4759 billion. We have 4 discussion papers for today's meeting, all submitted by the administration, totaling $34.4226 billion. If all funding proposals are endorsed by members, we would have approved 26 projects in total, with a total commitment of $68.8985 billion. Deducting $2.6474 billion of funding for land appropriation and computerization program, the project's total commitment would be $66.2245 billion. May I remind members that if you have direct or indirect pecuniary interest in relation to any item for discussion today, please disclose the nature of the interest before you speak in accordance with Rule 83A of the Rules of Procedure. And I also like to remind members in relation to the voting requirements where direct pecuniary interests are involved in Rule 84 of the ROP. We proceed with PWSC. Paper number 4 in relation to the redevelopment of Queen Mary Hospital Phase 1, new acute hospital at high-tech development area, and also redevelopment of Kwong Hospital, Our Lady of Maryknoll Hospital, and Grantham Hospital Phase 1. Members are invited to recommend to the FCA the upgrading of 70 mm to Category A at an estimated cost of $13,556 million in MOD prices, the upgrading of 87 mm, the new acute hospital at high-tech development area to Category A, and also redevelopment of Kwong Hospital, and totaling 10,049.3 MOD prices, 88 mm, redevelopment of Our Lady of Maryknoll Hospital preparatory works to Category A, $197 million, and also redevelopment of Grantham Hospital Phase 1 to Category A at $422.5 million, totaling to $29.58 billion. The matter has been discussed by the panel with the support from the panel, and the relevant discussion paper has also been tabled. I'm not going to read out the attendance list because it is a long one, but they're here, so I will welcome questions from members. Ms. Tanya Chan, 4 minutes. Chairman, it's a rather general question. I am a member of the Public Accounts Committee, and in the recent Audit Report number 9, Chapter 3, it relates to the hospital's authority managing the public hospital projects, and it was found that the resources have not been put to optimal use, and some resources are wasted. Now, we are now discussing 4 projects involving redevelopment hospitals, and I'd like to ask the administration what measures will be adopted in your planning and in your assessment of the resources needed based on the tendencies, procurement of equipment, the overall blueprint. I mean, what assessment you have made to tackle the issues such as space not fully utilized, resources not fully utilized, and not honoring the performance pledge in terms of service delivery. So, Under Secretary. Thank you, Chairman, and thank you, Ms. Chan, for the questions. Planning for hospitals is a very complex matter. I'd like Mr. Lee from the Hospital Authority to elaborate on the answer. Regarding the the audit report or the Public Accounts Committee is concerned, in fact, the Commissioner did not mention the wastage of resources, but rather issues like the Northern Lantau Hospital. Since its commissioning, there are facilities, for example, restaurants, that lacks a suitable operator in its operation. And in the initial period of the hospital's commissioning, some space were used for storage, which is undesirable. In terms of hospital planning, of course, I will do a better job. Well, Mr. Lee, let me tell you, for example, paragraph 15, insufficient use of resources. You talked about the restaurant, but we're talking about medical equipment. Well, if you need pictures, I can go up to the office and print some for you. Mr. Lee. Well, low utilization, it depends on the location. For example, for Northern Lantau Hospital, the planning is dovetailed with the airport's development. So under, in the case of emergencies, some facilities might be used, but not at other normal times. That means during major incidents, these facilities will have to be made available for use. Well, Chairman, but for some facilities, the maintenance period has almost come to an end. Well, if he's not answering my question anyway, I will follow up on this matter at the Public Accounts Committee. That's how the HA does its planning. You talked about how complex hospital planning is, and you talk about the accuracy of the report. I ask what they have done, what preparation they have done. Mr. Lee, any response? In terms of equipment, facilities, they are planned according to the service needs, and as I mentioned, for Northern Lantau, it is planned so that it can cater for any major incidents at the airport. So despite the low utilization, there is in fact an explanation. At normal times, I suppose we should be able to meet the target utilization rate. Well, let me also mention that for Northern Lantau Hospital, there are criticisms that we have the hardware ready, but not the software. And that's a practical problem. I understand Ms. Tanya Chan's question, and indeed you can follow up on the issue at the Public Accounts Committee and also at the panel on health services. I think that public health care is of course the concern of members. Mr. Wilson, 4 minutes. Well, Chairman, on behalf of residents in Wong Tai Sin, Eastern Kowloon, I'd like to reprimand the Food and Health Bureau for neglecting the public's views on the redevelopment of the OLMH. It was built in the 60s. It has only 230 hospital beds. And in Wong Tai Sin, the district population is 400,000. And according to the CNSD's information, the population there is aging quite rapidly. And I suppose you also understand the public's aspirations. Apart from redeveloping Our Lady of Maryknoll Hospital, there should also be enhanced A&E service. And the DAB has been striving to striving for the development. And we visited the Food and Health Bureau. We expressed our wish to government officials. We also attended the Legislative Council meetings. We emphasized that after its redevelopment, the OLMH should come with A&E service. Instead, the government is dishing out $197 million for the redevelopment of the OLMH with nothing but an additional 56 hospital beds after request from the public. So $197 million to redevelop OLMH. And instead of upgrading its service, there is strong opposition in the community. I mean, in theory, we should support the redevelopment of public hospitals. But the point is, after its redevelopment, the hospital is still not meeting the needs of the community. For Wong residents, when they call an ambulance to go to an A&E hospital, they either go to the United Christian Hospital or Kwong or Queen Elizabeth Hospital. And according to paper provided by you to the Legislative Council, it takes a 15-minute journey to reach the hospital. So, Secretary, you should understand the plight facing the patient if he has to travel 15 minutes to the A&E. And also, the Secretary claims that she would be going to the community, but she is nowhere to be seen. So really, you should heed the views of the residents. There should be an A&E service after the redevelopment of the hospital. And let me show you this table. You are not meeting the demand of residents there. So once again, I ask the administration to go back and rethink. Why can't you meet the needs of residents? Is it that Wong Tai Sin residents are second-class residents? They cannot enjoy A&E service in their own district? Why is it that despite dishing out $197 million, the plan is still far from satisfactory? Why are you bundling everything together? Why don't you take out the OLMH out of the item, and it will be expanded in size? It will increase from 800 square meters to 1,600 square meters. So can you explain why, despite the increase in size, you still cannot provide A&E service to meet the needs of Wong Tai Sin residents? And the Secretary, you have 20-odd seconds to respond.
Thank you, Chairman. Thank you, Mr. Hall, for his question. The planning and the function of each hospital is considered within the overall context of the provision service by the hospital authority, and we do consider their needs. Now, 3 projects are within the Kowloon Central sector. One is Kwong, the other is OLMH, and then the new acute hospital in Kai Tak, so they can address the needs of people. I asked to vote on this separately. You mean you, by voting, you want this to be separately voted? If it is agreeable, then we can do so. Items within one document can be split up separately in the voting process. Yes, I asked for separate voting for this item. Yes, next, Mr. Yu Siwing, 4 minutes. Thank you, Chairman. I also want to follow up the redevelopment project of OLMH and then Grantham Hospital, or GH. GH will be two nurse quarters will be demolished, and then the whole hospital will be redeveloped. And OLMH is sort of upgrading. I don't know what are the standards for upgrading and redevelopment, and what are the reasons for upgrading, and what are the reasons for redevelopment. If you can give a good explanation, then that may be able to address Mr. Oh's dissatisfaction. As for OLMH and Grantham GH, what are their final budgets? You need to conduct preparatory works. One is $197 million, the other is $422 million. The two, there are differences. Is it because of the difference in budget or the scale of the project?
Thank
you, Chairman. Thank you, Mr. Yeo. The two hospitals will be redeveloped. They are redevelopment projects. They have long history, and the hardware of these two hospitals cannot meet the standards of present-day requirements, and therefore we ask for redevelopment. As for the funding in phases, Mr. Lee will explain. As for OLMH and GH, there redevelopment require the recruitment of consultants and engineers to do detailed design. That's why we want to upgrade part of the projects to Cat 1. Since design has not been completed, we don't have an actual or an accurate number for members. As for OLMH, there is the upgrading of the outpatient building. This is upgrading. You say it is a redevelopment. Now, if the two are redevelopment projects, why the costs are so different? I think the redevelopment, the scope of works are different. Well, they say they are not able to provide the accurate numbers. Is it a difference in size or what? The calculation is based on size, and the scale of redevelopment GH is bigger. It is more than twice the size of OLMH, and therefore the consultant's fee will be higher proportionately. So it depends on size rather than complexity of the works. Whereas for consultancy fee is mainly the scale of the project. As for consultancy fee, according to your paper, you have assessed it beforehand, haven't you? Yes, this is an estimate, and while we are doing a tendering exercise, we cannot have a fixed number. You can estimate the cost. We do have an estimate. It's just an estimate. Next, Mr. Wu Chi-wai, 4 minutes. Chairman. As for OLMH, in this funding proposal, it is not for the redevelopment of the whole hospital. It's only for site investigation, consultancy, fee for recanting. And how much exactly is the redevelopment cost? When will redevelopment begin? And when will you come back to this council for funding for building or redeveloping the hospital? Now, when you come for the funding for redevelopment, how will you answer the issues raised by the Wong District Council? OLMH is suffering from a site constraint. In the vicinity, there are social welfare services, institutions like the clinic and the home for the elderly, Kwong home for the elderly, and also there is a children's home. Is there any plan to deal with these social welfare institutions or social service institutions together so that the site of the hospital can be expanded? Now, Kwong old people's home has already been vacated. Now, if you have more space, then a lot of issues can be addressed. Say the site can be incorporated in OLMH and become phase 2 or phase 3 development. OLMH is a community hospital as far as its positioning is concerned. I have been arguing with the HA. A community hospital should be able to handle not so serious acute patients so as to stabilize their situation before transferring to other more comprehensively equipped hospitals. That is sort of a 24-hour emergency service. Say in North Lantau Hospital, North Lantau Hospital cannot address all the problems of the patients. Some patients are stabilized and then transferred to Princess Margaret Hospital. Now, with so many elderly people living in Wong Tai Sin, with such a keen demand for medical service, shouldn't OLMH meet the needs of the community? And with the completion of redevelopment of OLMH, will there be adequate equipment to handle 24-hour emergency service, i.e. stabilizing the patients and then transfer them to bigger hospitals? The Undersecretary. Thank you, Mr. Wu, for the question. As for the Kowloon Central cluster, emergency service is the issue raised by the district councils. As a matter of common concern, let me stress that the three projects, Kwong, New Kai Tak Emergency Hospital, and OLMH are within the same cluster. It's a package. With completion, total number of beds will be increased by 1,000, and capacity of A&E service will be increased by 50%. And Kowloon East cluster's emergency service can also help to a certain extent. And we are working closely with the ambulance service to shorten the transporting route so as to provide the quickest A&E service. Well, for this project, is there a reconstruction of the main building? Certainly there will be. OLMH redevelopment project, the present proposal is just preparatory works for the redevelopment. It is not the actual redevelopment. Your time is overrun, but it needs clarification, Mr. Lee. It is mainly preparatory works for detailed design, mainly. The $100 million are mainly for consultants' fees. We don't have the detailed design, but roughly it will be in the range of $3 to $4 billion. But that will have to be dealt with later. When will you redevelop the main building? Well, maybe 2 years from now. So the $100 million are for preparatory works. Members are reminded that those who have spoken, members who want to speak are given 4 minutes for the first round, and that includes questions and answers. Please reserve enough time for the officials to answer questions. Next, Mr. Vincent Cheng, 2 questions. On the redevelopment of Kwong Hospital, I support that, and we discussed that for a very long time. In Kowloon West, there is shortage of medical and services. As for the discussion on transportation, traffic is very congested, and there's a problem. And I want to stress the issue of OLMH. I agree with all. I'm dissatisfied. There are many elderly people in Wong Tai Sin. There's shortage of A&E service. You spend a lot of effort in redeveloping a hospital, but there is no A&E service in that hospital. You owe them the service. Now the residents are sent to Kwong, UCH, and QEH. You're just adding more workload to Kwong. In redeveloping OLMH, why don't you consider providing A&E service there? Now, there are 18 districts. Is it that only Wong Tai Sin doesn't have A&E service?
答咗最尾嘅問題先啦。根據依家嗰個分區嘅情況咧。
According to the present cluster arrangement, apart from Wong Tai Sin, Central and Western and Kowloon City doesn't have an A&E hospital within the district. But we do want to meet the needs of the people. With regard to the redevelopment, or with regard to the 3 hospitals in Kowloon Central, they cooperate with each other. With the completion of New Kai Tak Hospital, the distance from Kai Tak to Wong Tai Sin is closer than Kwong. 30% or nearly 50% of the users come on ambulances, and we'll work with the fire services to draw up a better plan so as to send the patients to the A&E department ASAP. Well, I'm not happy with the answer. Well, this A&E service is emergency, right? And Kowloon East and Kowloon West are congested all the time, and my patients have to take a ride for nearly an hour to go to the A&E department, and that's really not satisfactory.
咁都係有個急切嘅需要，我知。
我聽到嗰個
I heard the reply. The emphasis is that item 2, new A&E department, A&E hospital, new acute hospital in Kai Tak, and the bureau says that also says Wong Tai Sin, and the traveling time will be shorter, whether you accept it or not. Kai Tak is not Wong Tai Sin. Kai Tak is Kowloon City.
下一位㗎啦，如果你冇再跟進提問，好嘛？就張超雄議員。
All right, next, Dr. Fernando Zhang.
So we have 4 redevelopment projects and 1 new hospital for this paper. Well, of course, we support the construction or redevelopment of hospitals, but it's really difficult to have a bundled discussion covering 5 hospitals. So let me ask a more general question first. About victims of sexual assault or sexual crimes, I'm concerned about the facilities in the hospital. In some other countries, they have this facility in the A&E department, and when the victim of such a case arrives at the A&E department, she or he would feel safe inside instead of being exposed in a very hectic hospital environment without any privacy whilst taking a statement. And the Rain Lily a few years ago collaborated with Kwong Hospital, and therefore now in Kwong Hospital there is a round-the-clock one-stop service available, so that the police, the forensic examiner, together with the Health Services Division of the Department of Health, as well as doctor at the A&E department, can use the facility, and the victim will not be required to go to different places for the services. And it is important that the victim is prevented from being traumatized a number of times. Kwong Hospital will be redeveloped, and the facility will be reprovisioned to United Christian Hospital, and then the UCH will be reprovisioned. It will be redeveloped. It will be reprovisioned to the Prince of Wales Hospital, and the facility is supposed to be moved elsewhere. Unfortunately, the CEO of the HA agreed that after redeveloping Prince of Wales Hospital, the facility will be moved back. But I want to emphasize, for other hospitals after their redevelopment, there should be such a facility available. If you don't make way for this facility now, they won't be able to provide the service. So be it Queen Mary Hospital, Kwong Wah Hospital, or the new hospital at Kai Tak, in your development or redevelopment projects, do you have it in your plan? That is a one-stop service for victims of sexual assault. I think your question is clear. Under Secretary, your response? Thank you, Chairman. I'll defer to Mr. Lee. Yes, Mr. Donald Lee. Well, at this stage, we have not included the facility proposed by the Rain Lily in the hospitals. But we have made space in Kwong Hospital, as you mentioned, for this facility. And we have listened to your view and will consider this proposal in the future development plans. All right, so you will give it a thought. And Dr. Tung can follow up on it after the meeting. I don't think any special facility is needed. All you need is a room, perhaps in each hospital. Yes, but the point is, when the victim arrives, the victim doesn't even have a room. So that means if you are minded to do it at this stage, you can plan to provide a room. Dr. Tung, you can follow up on the matter after the meeting. You may not be happy with their answer at the moment, but they already said they're happy to explore it. I am an engineer by profession, and I don't think as far as the works are concerned that it will be very difficult. Mr. Ming. I'm also deeply dissatisfied with the redevelopment of OLMH. I think the administration is bulldozing it through. Why is it that there is lack of support from the community and from members? We're not trying to get in your way. We agree that it is part of the 10-year hospital development plan. But in fact, just this Monday, 13 members across the political spectrum met with the government to express our dissatisfaction over the redevelopment plan. Because Wong is one of the very few districts without A&E service. However, Wong has the largest elderly population, and many of them live on the hillside. And in fact, this hospital cluster covers 4 constituencies: Sam Shui Po, Wong Tai Sin, Yau Chim Mong. And for these 4 constituencies, only Wong Tai Sin is not provided with the A&E service at night. Well, for Kowloon City, we can go to the St. Teresa's Hospital, whereas for Wong Tai Sin, with the majority of the population being elderly living on the slopes, they are not given the A&E service. We're talking about $197 million for the redevelopment project. You're still at the planning stage, and yet you refuse to budge an inch to consider providing A&E rooms in the hospital. I want the administration to explain why you are refusing even to consider it at this planning stage. We're not talking about the funding for the actual construction. This is just a funding application for paying the consultants. I want to know why the administration is refusing us outright. The administration said that there will be A&E department nearby at the new acute hospital at Kai Tak development area. But we need to improve the existing hospitals. We want to shorten the waiting time in the A&E department. With UCH redeveloped and with the new acute hospital at Kai Tak, residents in Wong Tai Sin will be asked to use these hospitals instead of improving the facilities at OLMH. I really don't understand the mentality. Undersecretary. Thank you, Chairman and Member, for the comment. As far as the hospital facilities are concerned, different hospitals in the cluster complement each other. But we have 4 GC constituencies involved in one cluster. Is it really a valid argument to ask residents to go to different hospitals in different districts? Or from the perspective of the capacity of A&E departments, as I mentioned, after the new acute hospital at Kai Tak development area is commissioned, the A&E capacity on the whole will increase because we have the A&E rooms in Kwong and new acute hospital, and the capacity will increase by 50% comparing to the existing QE hospital and the Kwong capacity. And the Fire Services Department will also reroute the ambulance services to cover the population. Well, are you a recorder? After all, you're just repeating the same answer. We want to shorten the waiting time from 8 hours to 6 hours. Why can't you include this plan in your redevelopment planning? Anything to add? Nothing to add. Dr. Chang Shung Tai. Thank you, Chairman. About the OLMH and redevelopment of the 5 hospitals, I think the administration must respond to members' requests, especially in some communities. A&E services are not provided, and this is actually the major concern of members today. If we are to take forward the 10-year hospital development plan, and if we also read the audit's report regarding the HA's management problem over major or even minor works, we can't help but feel concerned about the redevelopment projects. For example, in the audit report, it is said that there is a high proportion of minor works not planned in advance. That means they may just casually start some projects, additional alteration works, and according to the audit report, it doesn't meet the 90% target of the set down by the HA in the 10-year rolling program. Second point, as far as the construction is concerned, there are also management issues over small to medium-sized works. Now, regarding these management problems pointed out by the audit, my question is this. You're going to take forward 5 development or redevelopment programs. I want to know whether you're going to accord priorities to these projects. Because, for example, for OLMH, you're going to extend the service hours by, say, 2 hours for the A&E department. But have you considered the needs of the community and take forward certain parts of the projects first, so that as far as the project management is concerned, you can avoid the blunder pointed out by the audit? Because over 10 years you will be working on these 5 hospitals. I want to know whether you have any idea how you're going to take forward these projects. Mr. Lee. Thank you, Dr. Jiang, for your question. Let me point out that for the minor works you mentioned, it's different from what we're discussing here. We're discussing public works projects. And let me respond to the audit report. Accordingly, we're not meeting the target because for the minor works, flexibility is needed. For example, there may be wear and tear of equipment or facilities. There might be E&M issues as part of our daily operation. We therefore need to take up the works despite the fact that they're not planned. So it's not, as you said, that we casually start projects. We have altogether 16 projects under the 10-year development plan. We have land sale initiative, and we also work with other departments, and we follow a timetable depending on how ready the projects are and how urgent the needs are. Regarding capital works projects, the audit report doesn't really refer to any major timing problems, except that the settlement of the balance might take a bit too long, and also perhaps we can follow up more closely the works involved. Next, Mr. Jeremy, 4 minutes. Thank you, Chairman. First of all, I agree that we should redevelop OLMH. But why is it that after redevelopment you cannot provide round-the-clock outpatient service? I haven't heard any explanation. For A&E department, you may say that they can be diverted to other departments, other specialties, etc. But what about outpatient clinics? It's just a matter of manpower. If you have more nurses, more staff members, you can do it. It's not a question of hardware. So first question, why can't you provide round-the-clock OP service? And second question, according to the paper, you're going to have 40 additional beds and 12 dialysis beds, altogether 292, because in paragraph 16, you mentioned that with 4 additional beds, there will be altogether 292 beds. I want to know whether you have included the 12 I mentioned. And is there any increase in floor area? Under Secretary, about the increase in hospital beds, 292 will be the total number, with 40 in inpatient beds and 16 related to blood dialysis. So altogether it's 236 beds. For round-the-clock service, I think the public is concerned about the A&E service. As explained just now, if the progress is smooth, the 3 projects will be completed in 2024, and there will be increase in capacity and service quality so as to meet the needs of the public in daytime or nighttime outpatient needs. For non-urgent cases, that is level 4 and 5 of A&E department, basically the needs are akin to OP. So as long as we enhance the capacity of A&E department as a whole, and also redeploy resources to cater for the needs of Wong, that should do. Mr. Lee, as far as the area is concerned, the OLMH at the moment has a floor area of 8,000 net square meters.
Our future plan is to double it to 16,000 square meters. Even if we don't add the number of beds, the design of OLMH is below standard. It was built a long time ago. Even if we have the same number of beds as it is at present, we still need to add some 40 or 50% of the floor area. So we double it. 292 is the total number of beds, including 40 plus 12, right? Yes, it is clear in the paper. Chairman, let me finish. You refer to the number. You can refer to the number. Let me finish first. You answer on behalf of the officials? No. Now, there is a paper for all of us. I just want to remind you. There's a reason for that. There's a reason for that. Well, I don't rule your question out of order. Well, I just say that your number is correct. When I'm asking the officials, you waste my time. Yes, I allow you to go beyond the time allotted to you. Now, the residents told me that your numbers were confusing when you gave to them. The 40 beds are not newly added beds because you cut the floor area. The residents find it confusing, and therefore I ask the question. You say after completion 292 beds. Now they say that's not true. They just pulling wool over your eyes. I therefore ask the question. Now before reconstruction, what is the number? Give me an exact number. I don't need to calculate. Let me explain. There are 236 beds. The plan is to add 16, so it's 252. We want to make full use of the space available, and we try to add more beds. Now, some supporting service will be relocated to other hospitals, and therefore there will be space for an additional 40 beds, and altogether 292. Next. See Viking. Now the CE puts emphasis on consulting the people. It is a new wave with regard to redevelopment of OLMH. I find the administration disappointing, and also the Bureau disappointing. I'm dissatisfied. They have ignored the long-term demand of the residents Wong Tai Sin. They have ignored the demand of the DAB Wong Tai Sin branch. It is not the demand by a single party. I think other parties, you've ignored the advice of the Wong Tai Sin District Council over the years. You don't just ignore the District Council. The Health Services Panel, I move a motion and I got the support across the party line. I asked you to consider our proposal, but you didn't, so you just ignore this council. I'm extremely disappointed.
主席，而家個要求好簡單。主席，我覺得即係成件事嘅嗰個圖畫好清楚。簡單嚟講就係
The plan is very clear. The picture is very clear. OLMH is positioned as a community hospital, so you always right. If you have any problem, then you can go to the new hospital, and there will be an increase in capacity. That's arrogance. That's too much. You position it as such, but there are strong demands from the community, from the district councils, and across the party line. You say you want to engage the stakeholders, but you do not consider their advice. You say that's not technically possible. Now, with redevelopment, everything is finalized, and you close the door, and you don't want to consider anything. Now, it's before this subcommittee. Will you set aside your professional assessment? There is a wide demand, widespread demand across all spectrum. Now, with the new hospital, everything will be okay, and therefore no need for OLMH to provide A&E service. But will you actively consider the demand of the District Council and this Council? The Undersecretary. Thank you, Chairman, and thank you for the question. I'll try my best to express this. I know that the residents are very concerned about whether A&E service will be adequate, whether they can go to the A&E department to get help within the shortest period of time. If the 3 projects are completed on time by 2025, they will be completed in terms of number of hospital beds and capacity of the A&E departments. Everything will be increased, and that will help the cluster, to serve the residents, and they will get the service they need. My question is whether you would set aside your professional assessment. Across the party line in this council and the district council, people are calling for the A&E department. Will you consider the possibility? I ask you whether you will consider this. The Undersecretary. And the issue is about general outpatient clinic. There are daytime and evening clinics. We will actively monitor all outpatient services, the number of appointments, whether the needs are met. I've noticed that this morning we spent nearly an hour on the issue, and the focus is on the redevelopment of OLMH. The proposal by the administration in respect of the OLMH is preparatory works, including site investigation and also recanting or relocation of services, and also works on detailed design. As for the main building works, that will be in the next stage, and they will come back to this council sometime later. since it is all about preparatory works, I don't think everything should be fixed now. Ms. Lee asked for further discussion. For the hardware is there, so the question may just be adding more manpower, more staff members. So at the present stage, I think the Undersecretary is not able to address the concerns of members. If there can be discussion, then I think subsequently, then I think the discussion on OLMH can be stopped. This is my observation. Well, I asked the Undersecretary whether there can be further discussion. If so, then we can put the proposal to the vote. The Undersecretary. First, on A&E service and design. The Undersecretary, you don't need to repeat your point. I understand the point that the facilities do support each other within the cluster. But there is such a demand across the party line, and the $500 million are about preparatory works. You don't need to put everything to cast everything in iron. Just clarify whether there will be further discussions, address the concerns. Let me add quickly. We are happy to discuss with all parties concerned, including councillors and also people of the district. If there can be further discussions, then you don't need to ask further questions on this issue. We've heard that. Ms. Holden Chow, 4 minutes. Chairman, with regard to the new Kai-Tak Acute Hospital, or NAH, there is this arrangement. The services from QEH will move there. With regard to QEH, what are the number of beds and number of OTs, operation theaters? Do you have the number? The Undersecretary. Thank you, Chairman. Thank you, Mr. Chow. Dr. Ho of QEH will speak. Will answer the question. Yes, Dr. Ho. QEH. About 1,800 beds. Yes, roughly 1,800 beds as the number of OTs. I think 16. According to the paper, the NAH provides 2,400 beds. It has to handle the transfer from QEH. That's already 1,800 beds. NAH isn't just for receiving QEH. It is serving the whole cluster. Well, I don't repeat the point on OLMH. They want A&E service. It will also be put on NAH. Now you say you put everything in NAH. The 2,400 beds are to cater for all these services. Just QEH has 1,800 beds, and they will be relocated to NAH. And there is a growing population. I'm no expert, but my concern is that you just use Kai-Tak or NAH to deal with everything. That may not be adequate. I hope the Bureau will carefully consider the proposal of our colleagues, providing more services in different hospitals so as to spread out the service to meet more demands. Thank you. Do you have anything to add, the Undersecretary? Yes, just a quick point. In the coming 8 to 10 years in Central Kowloon Cluster, apart from NAH, that is the Kwong Hospital, Buddhist Hospital, so on and so forth, and the total number of beds added will be to the tune of 1,000 beds, and there will also be substantial increase in A&E service. Next, Dr. K.K. Kwok. Thank you, Chairman. Concerning the overall plan, I do support these projects. I've noticed that there are many redevelopment works, and the potential has not been fully utilized. Now, the ratio is 5.5 for 1,000, and the number may become 4.2 per 1,000. And then with aging population, that may not be adequate. Redevelopment of hospitals may not be adequate. I find it a pity that OLMH is not fully utilized. The site is big. We are not just short of A&E department. We also need rehabilitation service, rehabilitation beds as well. Will the administration consider make good use of the site potential, other sites have exhausted the plot ratio except for OLMH. So will you increase the number of beds, say, use it for rehabilitation or other service, medical services? As for NAH, they're going to spend more than $10 billion. 5.3 billion on foundation and support. I want to know the cost. The $200 billion are there, and if and only then.
Point number 3 earlier, according to the Financial Secretary, there would be phase 2 redevelopment of QE Hospital. After reprovisioning QE to Kai-Tak NAH, the site will be reserved in full for another hospital. The third point is about the Rain Lily. I'm disappointed by your answer to Dr. Zhang's question. Well, Undersecretary deferred to Mr. Lee to take his question, but in fact, Undersecretary, it should be your question, because as a doctor, you should know very well that victims of sexual assault have all along been neglected in terms of their needs. We only need a room to do that. In many other countries, they already have this room available in a hospital. But unfortunately, in Hong Kong, there isn't a single room to accommodate these facilities. And the facility is now reprovisioned to different, time and again to different hospitals. For Kwong Hospital, QMH, etc., there should be such a room to help these victims. This is just a minimum requirement, Undersecretary. Don't shun the question and let the doctor answer the question. Undersecretary, thank you for your questions. Let me briefly respond to your questions, and then I'll defer to the HA to give you figures on, say, pricing. About victims of sexual assault, I think just now I already supplemented the answer. In terms of hardware, we do have flexibility in designing new hospitals where this facility can be accommodated at the A&E department, and also an integrated approach in the service delivery. I think we can discuss it in future projects. And then I'll defer to Mr. Lee. What about the QE hospital? The future expansion project of QEH. In the second 10-year hospital development plan, there will be another hospital there. Would it be a general hospital with A&E? We haven't started planning, but it will be reserved for a hospital. According to the paper, the government is going to conduct a study on the provision of hospital at the former QEH. And you're also maximizing the GFA for OLMH. Right, there are a lot of comments that we are not making full use of the floor area, but in fact for the advanced works, we're already maximizing the floor area. Are you referring to the plot ratio? Because we're not allowed to use the BD's floor area, the plot ratio can be up to 10, but then we have the building height restriction of 7 stories, meaning we can never reach a maximum plot ratio of 10. We also have other development guidelines such that the site coverage cannot exceed 65%. So at most, we can only reach about 4. When we sought advice from the planning department, they gave us a plot ratio of 3.6. And we have managed to push it to 3.8. So we have definitely fully utilized the development parameters available. What about the pricing? $50 billion, that's our preliminary estimate. For the 10-year hospital development plan, we need to keep close watch of the budget, and we're confident that we can manage all the projects within budget, so there won't be any cost overrun. About the NAH at Kai Tak DA, it's for foundation, the construction of a basement, piling works, and the hospital would cost $50 billion. I think that we have learned this long ago. Dr. Helena Wong, first round, 4 minutes. Chairman, the Democratic Party supports these 5 hospital development and redevelopment projects, but we also have questions and comments for the administration. We are concerned about the supporting transport and pedestrian connectivity. Let's talk about parking spaces for the public. I understand at Kai Tak development area, a basement would be built. I want to know whether you have made an estimate of the number of parking spaces for the public. Have you paid any attention to that? Because for existing hospitals, there is generally insufficient parking spaces for visitors and for transporting patients. I want to see if the administration will improve the parking issue for the new hospitals. Next question. The new acute hospital will be next to the Children's Hospital at Kai Tak. It is situated along Kai Tak waterfront. We very much hope that apart from land connection, a pier can be built so that visitors can access the hospital area by sea. Third point about the redevelopment of Kwong Hospital. We hope that the connectivity can be improved. It is very close to Yamate MTR station, be it Pitt Street exit or the other exit. After leaving the MTR station, the visitors will have to walk at grade and be exposed to the elements, and this is especially bad for elderly. Can you work with the MTRCL and the Transport and Housing Bureau so that a subway can be provided? There'll be underground connection from Yamate MTR station to Kwong Hospital without having to walk at grade. We contacted the MTRCL, and according to their reply, there is already an exit nearby, and at grade route is available, and they have no plan to build the tunnel or build a subway. I wonder if the administration would talk to the Transport and Housing Bureau to provide underground connectivity, and whether it is also included in the budget. About Dr. Helena Wong's suggestion, I understand that this is being studied at the moment. Let me take the question about Kwong and about the parking. Mr. Lee can supplement. For Kwong, we do understand the request from the community that there should be improved connectivity, especially underground. And we understand that this can help users in going to hospital, and we are working with consultants in conducting a study. Mr. Lee will take the other question. Thank you. About the new hospital or NAH at Kai Tak, we have planned 900 parking spaces. Depending on the operational needs of the hospital, a certain proportion of the car park will be designated for visitors. But we need to keep things flexible because during the day there may be more medical staff attending work. At night there might be more spaces for the public. Chairman, can we ask the administration to give us a reply in writing before submitting the item to FC, the number of parking spaces in various public hospitals? Well, you'd say that there would be more public parking spaces at night time, but visitors don't just go to hospitals at night. They might visit the hospital during the day. I don't know whether figures are available at the moment, but please provide information in the supplementary paper. But they should include this in their plan. Yes, but I understand that for some projects they are really at the preliminary stage. But anyway, please provide a reply in writing as to the car parks in hospitals. Next, Mr. Aulokin, 4 minutes. Thank you, Chairman. I support these 5 hospital development and redevelopment projects. I'm also a district councillor of the Southern District. So regarding QMH and Grantham Hospital, I'd like to express my view on the progress of redevelopment. First of all, I thank the administration and Dr. Lok for maintaining close liaison with the Southern District Council and for heeding our views. On building a lift tower connecting Pok Fu Lam Road or to QMH, well, at least you will consider the option. And at the last SDC meeting, you provided a draft plan of a lift tower for our reference. I think this will be welcomed by the community. At the same time, we have received comments regarding the redevelopment projects. We hope that they will be included in your plan as well. For QMH, I think the major concern is this. Many members are concerned about public transport, taxis, GMBs, then their parking bays inside the hospital. We hope the hospital can give us a clear answer. I understand it is still at the planning stage, but the community is concerned whether there are sufficient parking spaces for public transport as well as visitors coming in private cars. So we want to have clear information from the administration. Next point. Well, the SDC has also been striving for the SIL West to be commissioned. It's still in the pipeline, but I think that our request is clear. If the HA could work with us in this regard, it will really help improve public transport. Third point about Grantham Hospital. The Health Services Panel has also received a letter from the SDC expressing our wish to give consideration to the Ocean Park project so that overall speaking we can improve connectivity by, say, providing a pedestrian link. We haven't heard a reply. I hope that the Grantham Hospital redevelopment project can give this a thought. And the Secretary, I'll give the floor to Mr. Lee. about connecting the Ocean Park Station to Grantham Hospital. In fact, in the consultancy fees covered in our proposal to upgrade the project to Category A, it will be covered. And after the consultant looks into the matter, we will consult the SDC. As for Dr. Helena Wong's point, we will provide a supplementary paper later. Next, Mr. Leung Chi-Chang, 4 minutes. Thank you, Chairman. About QMH. There's a helipad. I am not very familiar with the area. I mean, there is an existing helipad, but it will be redeveloped and it will be subject to an EIA. I mean, the facility doesn't exist at the moment. I wonder why we need one. I understand that QMH is quite famous for some of its specialties. And yet I don't know whether the rooftop helipad must be provided in order to provide service in full, because the route of the helicopters may affect the neighborhood, the residential neighborhood. And about the NAH at Kai-Tak development area, about the sports trauma division, I want to know whether it will be provided, because there is a Kai-Tak sports complex nearby, and there will be athletes using the sports facilities there, and then they might need treatment and rehabilitation.
The
Undersecretary. Thank you, Chairman. As for the helipad, Mr. Lee will answer. As for the development of different specialties, say for example sports trauma, that's the sub-branch of orthopedics and also rehabilitation specialty. Mr. Lee, there is no helipad in the present QMH, but it is a trauma center, so it's better to take the opportunity to build a helipad or helipad. And we have already gone through the EIA, which is required by law, and we've already got the environment permit. The director can explain. Yes, the director, Mrs. Lam. The helipad is under the EIA ordinance, and we need to get an environmental permit. The noise and also other environmental impacts will have to pass through the EPD. The EPD has already given out the permit, and we need to have some measures. I will put up noise barriers on the rooftop. I'm talking about the flight path. It's not just a helipad. Not too many people are living nearby. But what about the flight path? Say there may be helicopters flying in. Have you talked to the aviation department or other authorities? In the EIA process, that is also taken into account. And as for our project, we look at the sensitive receivers. And on that account, we need to put up some noise barriers. And if there is any change in our design, we will have to get the final approval of the EPD. And that will all be incorporated in the detailed design. Now, this is a new facility. apart from putting up the noise barrier, will there be any requirement in terms of flight paths to minimize impacts? Well, that can be followed up later. Mr. Paul Chair, I refer to the OLMH. Para 7 provides data on how big the population Wong Tai Sin is, how crowded it will be by 2024 by the completion of the project. The number of elderly will increase from 73,000 to more than 102,000. These are the justification for funding increase. But with a bigger population, then when the hospital is completed, the capacity will still be not enough. Even Ms. Lee, who used to be very calm or mild, has criticized the administration for ignoring the demand of the district council. She is very strong in condemning the administration, though she has not participated in any walkout. Well, the support is broad and wide as far as the provision of A&E service in Wong Tai Sin is concerned, and as a mouthpiece for Wong Tai Sin residents, I want to re-emphasize this point. This is a demand for many years, and I also thank the chairman for giving a hint. It seems that the chairman is hinting that if the officials are not so adamant in refusing the proposal, then the proposal can get through. But this is something I want to say. Now you are going to conduct investigation and do other preparatory works, but if these things are done, then there may be a way of no return. Everything will be fixed and nothing can be added. If you go from A to B, if it is the nearest point, it will be the quickest. But from a political point of view, you should not just walk from A to B. You may need to walk from A to C and then back to B. That's the cost of democracy. Shouldn't the Undersecretary, therefore, give a big undertaking? I heard that Mr. Wu Chi-wai referred to other facilities nearby. Can they be dealt with together with the OLMH? I've heard the DAB's demand for 24-hour service, A&E service, and increase the number of beds. I think they have increased the number of beds to a certain extent. They increased from 26 from the number of 26 beds to 52, or 42 rather. And after redevelopment, 24-hour service can only be provided if manpower permit. Now, Chairman, this is rather controversial, so can you separate this item for voting? That has already been asked for this morning. Well, I don't need any reply, but I think that's the right direction. He has used more than the time allotted, but I still ask the Undersecretary to reply. Let me stress that this is about preparatory work, or preparatory works. The future design has not been finalized, and it is not about facility, but it's about operation, and therefore it is not to be decided by the PWSC. If they can add more hands, they can add more manpower, then they can provide the service, because the place is set. The Undersecretary, as for operation matters, they can be discussed, of course. The provision service requires manpower and will actively consider the manpower issue so as to strengthen our service. As for hardware, with the completion of the Central Kowloon Works projects, they will be completed in 2024 only. And if we consider involving many other things, then that may seriously delay the provision of hardware, and that will backfire. Next, Mr. Lau Kok Fan. 4 minutes. With regard to hospital redevelopment, it is an urgent matter. Residents and councillors all welcome this. Well, with redeveloping a hospital requires a long period of time. Members are therefore concerned whether after redevelopment demands can be met. This morning I met with a group of Wong Tai Sin district councillors and also residents. And they are really concerned about the redevelopment of OLMH. You've heard the demand for 24-hour service and A&E service. These are important to them. Wong Tai Sin doesn't have that service. And the residents and the elderly in particular have such a demand. So I hope the Undersecretary will listen to their views, talk to them, go back and think about it. And if you have any difficulties, you can go to the District Council and explain to them. That's why I urge officials to go to the district and visit the district councils. Now, last time the Policy Secretary didn't go there. The Undersecretary went there and had the views. So will you arrange a meeting for the Policy Secretary to go to the District Council, listen to the voice of the District Councillors and the voice of the residents? The Undersecretary. Thank you, Chairman, and thank you, Mr. Lau. With regard to communicating with the District Councils and the residents, we're willing to do that, and I believe the Secretary is also willing. As for hardware, in Sha Tin Pass, there is the hospital and also OLMH, and there is also the redevelopment of Wong Tai Sin Hospital. That is something actively considered by the HA. So apart from OLMH, there is the redevelopment. There will be the redevelopment of Wong Tai Sin Hospital, and that will go a long way to help the residents. We are willing to talk, and we just want to stress that we need these hospitals to be rebuilt so that by 2024 they can be completed. As for the number of beds, you've heard the views, and you've also responded and made some improvements. It may be difficult. You're just considering Wong Tai Sin Hospital, but you have not given a complete picture to the residents of Wong Tai Sin. In the future, whether there will be an A&E service. Now, with redevelopment of OLMH, you had more beds. But will you also say that after so many years, there will be such and such service in Wong Tai Sin Hospital? The problem is they can't see the full picture. Well, there is communication, but we want this thing to be done as soon as possible. Can you tell them when the Secretary will go to Wong Tai Sin and talk face-to-face to the district councillors? Well, as for meeting arrangement, the Undersecretary, do you have anything to add? As for our bureau meeting the residents or the district council, we can make arrangements for that, of course. Mr. your second round, 3 minutes. Chairman, the reply by the bureau and the secretary are not adequate. It's just a tape recorder. He is giving no justification for the proposal. Redevelopment of OLMH is good, but they spend nearly $200 million on that, but cannot address the demand of the residents. That's too bad. When papers are put before this council to solicit support, the administration usually carries a paragraph. The paper usually carries a paragraph on public consultation. This is a real demand by Wong Sin. Now, in enclosure 4, page 3, paragraph 10, it is said that the evening service will be until midnight, until A&E service of NAH. After opening of NAH, they will cancel the evening consultation session. Is it the case? Now, will you actively consider the provision of 24-hour A&E service or 24-hour outpatient service? Why can't you deal with this like Northland Tower Hospital? After triage, then you provide A&E service, and then after triage, you send the patients to the other hospitals. Why can't you do that?
Let me respond to the questions one by one about triage. We understand previously there were triaging of cases. For example, for Northern Tower Hospital, because it doesn't have the A&E service and it is far from the urban districts, there is a triage station. But at night, when traffic is smoother, a triage of cases might actually stall the treatment of patients, and it is not desirable. Second point, I understand that there are calls for different services to meet the needs of patients in different circumstances at the community level or at the other levels. Third point, during this window period before commissioning of A&E services of NAH, we're going to extend the service hours for evening clinic, and we will keep in view the operation and make changes if necessary. Mr. Ray Chen. Well, although you said that this funding application is still some distance away from the actual construction of the project, but I see a very strong response coming from different members this morning. And I need to make this point. According to the administration, and in fact it's also set out in the paper, that is to say, before the commissioning of the NAH, after completion of OLMH's redevelopment, under a pilot scheme, the service hours for evening clinic will be extended to 12 midnight to serve the local community until A&E services of NAH commenced. I think there is a big problem here. Technically, you're suggesting that if there is a service gap, you're going to extend the service hours by 2 until the commissioning of the NAH. If there isn't a gap, you don't even need to do that. But it indicates that you actually understand that there is such a need. Let's not talk about whether it should be round-the-clock A&E. Let's just talk about extending the service hours of the evening clinic by 2 hours. I think your attitude should be to do it as much as you can. The attitude should not be something like extending the service hours by 2 before the redevelopment is completed. You cannot just pretend that you're going to do something about it, because otherwise, if the item is submitted to the FC, I think even Ms. Dari Lee would submit a motion under 37A, if not 32 of the ROP. So the objection here is really quite strong. Let me ask once again, why are there so many conditions for just a mere extension of service hours by 2? Because you understand there is a need already. You should do as much as possible and as soon as possible. Whether the services should be provided round the clock is something else. At least you can immediately extend the service hours now. About the evening GOPC service, we will continue to monitor the utilization of the GOPC in the evening. It runs from 6 to 10 p.m. And on an annual basis, we review the situation and consider whether service capacity needs to be enhanced. So whether or not the new hospital is completed, we're going to review the arrangement. It is just a temporary measure, extension of service hours. Well, because of a lot of reasons as explained, for example, before the NIH's commissioning, will extend the service hours, but after it is commissioned, we believe that the capacity of NIH is such that it can also serve other local communities nearby. And we're also developing another concept, district health centers, which can offer great help to the provision of services at night in hospitals. Well, Chairman, I hate to pursue this, but I don't think the Secretary understands. You say you monitor the number of unused quotas, meaning that you suppose it hasn't reached capacity. But the point is, you're suggesting by 2024, NIH will have been completed. But in the event that it is not completed, you are going to extend the service hours by 2. But the service needs are already here under Secretary. I talked about the utilization rate of A&E services during the day and at night for classes 1 to 3, meaning really urgent to semi-urgent cases. The figures are more or less the same. I suppose if the public accepts the evening GOPC service or evening A&E service, it should be able to cater the needs. And it's just a pilot scheme, a temporary measure. The focus is that we believe the A&E services of NIH, when commenced, will be able to meet the service needs. We have 6 more members having indicated the wish to speak. And I think in relation to the hospital development and redevelopment projects, members are in support. If need be, I can extend the meeting to 10:45. Well, I think from today's discussion, and let me explain the logic. My take is it's not logical. Let's say after NIH at Kai Tak is commissioned, it will be a large scale, a major hospital with comprehensive A&E services, and there will also be very good connection from Kai Tak to other districts. And by then, local residents may wish to go to Kai Tak Hospital anyway. We're talking about redevelopment of the hospital. That means hardware. And if with additional software, meaning manpower, we can provide round-the-clock service already. So we can have some flexibility here. Maybe by then, everybody agrees that quality services are provided by the NIH. And I think, Under Secretary, you should understand members' concerns, and you can give a very clear undertaking over this matter. I don't think we need to spend more time on it. We've spent an hour and a half on this matter. So a clear indication from you, Under Secretary. Otherwise, we can't put it to a vote. Thank you, Chairman. In terms of the arrangement of hardware and software, let me first explain about hardware in terms of using the plot ratio, maximizing the GFA available. I think I've explained this. Right. No problem, because you explained that apart from the plot ratio, there is also a BHR requirement. We're clear about that. We're not going after you because of the hardware problem. We're just saying that you should make good use of this opportunity to provide round-the-clock service in the future. But again, this problem has to do with the commissioning of the NIH, because by then, people may opt for NIH first. So with the same hardware, OLMH may be deployed additional manpower to provide round-the-clock services if need be in the future. I really don't see great difficulty, and I don't understand why, Under Secretary, you are being so stubborn, because this discussion can go on and on. Under Secretary, can you give a clear answer whether this is an option? Secretary, thank you, Chairman. As far as service delivery is concerned, we keep all options open. And we're happy to discuss further our arrangement based on the needs of the community, including service hours, service content, support service, etc. Mr. Ho-Kai-Ming, 3 minutes. Thank you, Chairman. We're still in the stage of preparation. I don't know why you are turning us down regarding the service request. I don't know whether other members asked about the plot ratio. Already asked. It's not fully used, but then there are other development constraints such as BHR, and I think the Secretary already explained very clearly. Chairman, I understand that, but I want to know what is the extra capacity brought about by redevelopment, because we have 400,000 population now. We have only 40 additional beds and also 56 additional GOPC quotas and 200 specialized or special outpatient clinic quotas. How are you going to convince the public, having spent $200 million on it? You say that by 2024 you'll be able to meet the demand, but then patients will need to go to another district, to Kwong, to QE, for follow-up appointment. Whereas after redevelopment, there will only be 40 additional beds and 56 additional GOPC quotas. I give you a chance to explain to the public, Under Secretary. While this is broadcast to the public, can you tell us whether it is worthwhile to spend so much money on this redevelopment project? I wonder if the Bureau is really committed to using the site to the full. There is a clinic opposite, and I understand. And I mean, have you considered the service needs in Wong Tai Sin? How are you going to deal with it? Because it seems that Wong Tai Sin is being neglected. We are second class. So I'll give you 1 minute, Under Secretary, for you to convince the public why, after dishing out so much on the redevelopment project, so little is given to the public. For Shatton Pass and the development in the vicinity, of course, we understand there is room for improvement. For example, Wong Hospital has a long history, and there is an urgency to redevelop the hospital, and that is why in the second phase of the 10-year hospital development plan, Wong Hospital will be included. There will also be enhanced link between OLMH and Wong Hospital. As far as OLMH's redevelopment is concerned, it's not just about service enhancement. There will also be upgrading of hardware such as spatial space for patients, but 40 additional beds, 56 additional GOPC. I don't know how you're going to explain that to the public. Next, Mr. Jeremy Tam. 3 minutes. Thank you, Chairman. According to your previous written reply, CB bracket 21177/1718 bracket 01, you replied and explained about the GOPC issue at OLMH. According to your reply, there would be 20,000 GOPC quotas after redevelopment, which represents an increase. Can you give me some figures? On a daily basis, say, what should be the quota of the GOPC quota at the moment? Let's be rational. Let's say every day you have X quotas, and if now you're suggesting that the service hours should be extended to midnight because of the number of quotas and the long queue of patients, then under the same mechanism, let's say if there are still many patients after midnight, then it is justified that you provide round-the-clock service.
Now you say you listen, but do you have an objective standard or number? Say, for example, the waiting time, say, more than 2 hours. Then you will increase the service. So do you have any objective numbers or standard? Say, just like adding more service, like the buses. You add one more bus if the queue is longer. Now in OLMH, when is the peak hour in which the number of patients is the most? Mr. Chong of the OLMH. Yes, please. Please speak. As for the GOPC, now it's provided to the whole of Wong Tai Sin district. There are 5 GOPCs. What about OLMH? As for the quota, morning till 10 evening, we provide GOPC. I can only provide an actual number after the meeting, but the appointment sessions are fully utilized. We don't look at evening service only after redevelopment. Now we also consider providing evening service after work, and also on Saturdays and Sundays we would like to strengthen our service. You don't even know when is the peak hour because you just hand out the quota. What is your standard for or objective measurement for whether to increase your service or not, or lengthen your hour of service or not? Well, we will consider when or in which district has the greatest number of demand. Well, they say they don't have the numbers in hand. They will give you an answer in writing. Ms. Wing Yang, your first round, 4 minutes. Ms. Wing Yang. Ms. Owen Young. Chairman, I don't want to be long-winded, but basing on the questions asked by Mr. Tam and also the answer by the officials, I want to ask, now if we pass the proposal in at this meeting, can they provide the data before the FC? Well, I think they can. Mr. Chong has already said so. Yes, the Undersecretary. We will certainly provide the numbers so that you can have a better understanding of how we can increase the number of appointments to meet the needs. We handle our service flexibly, whether it is the number of appointments in the daytime or in the evening or even during the weekends or during the holidays. We'll increase our appointment sessions when there is a demand. Now we can look into increasing our service flexibly. Now you are already aware of the demand in the district. Why you have to wait for the completion of NAH at Kai Tak before you can provide 24-hour service at OLMH? As for the provision of service time slots, that can be dealt with flexibly. First, within the same time slot, can we increase the quota? And then we can also consider lengthening the hours. We're going to add more than 100 beds, and we have not done that before. Now you can see that the bottleneck is the long waiting hours at an A&E department, and also long waiting time for getting admission into the medical wards. We will, of course, these are our priorities. Of course, we will deal with the GOPC quota. In other words, if you lengthen your service hours, the HA and the Bureau do not consider that a priority or an urgent demand. In the long term, if manpower can be added, and this second priority service can be dealt with. If that is the case, then we will have to work in other areas. The Undersecretary, as for service, sometimes the bottleneck is the shortage of manpower, sometimes it's the shortage of hardware, and we will deal with that accordingly. Well, you can't get water from rock or drilling rock. Now, if you can provide the paper to us before FC, that will be helpful. I hope the Undersecretary understands that before redevelopment, there can be enhancement of service at OLMH. And after completion of redevelopment, members want to know more about, say, the extension of service hours. We spend nearly 2 hours. That's the focus of the discussion. If the Bureau is open-minded with regard to its answers, then this may address members' concerns. Of course, the Undersecretary can express his answer in different ways, but my understanding is that he has an open mind and he can explore the service, the expansion of service. I just want to know my understanding is correct. Yes, your understanding is correct. Dr. K.K. Kwok, your second round, 3 minutes. Chairman, 2 questions. With regard to QMH's redevelopment, that is the cardiac catheterization service. I don't know when you will implement 24-hour emergency cardiac operation. This should be done in the interest of the patients. That should be done as early as possible. But this is also a heavy workload for the medical personnel. If they have done 24-hour cardiac operation and they will have to do other duties during the day, that will be too heavy for them. For those who are on duty in the cardiac emergency operation service, then do they have a separate time schedule or work schedule? Next is on full A&E service, say QMH, QEH, and other large comprehensive hospitals. They have trauma, traffic accident, cardiac or brain service or neurology service. But that's not the case for OLMH. My understanding is that they want 24-hour GOPC, and 24-hour GOPC service is nothing new. In fact, there was such a service in Fanling when there was no North District Hospital. In different districts, there are 24-hour outpatient service. This may not be able to deal with trauma, but when somebody gets high temperature or gets sick, feels unwell, then there is a 24-hour outpatient service for them. I just want to know what HA facilities are providing this, and why can't that be put at the OLMH? The Undersecretary. First on cardiac service. Dr. Chong. Yes, Mr. Luk. It should be Mr. Luk. Yes, Mr. Luk. Dr. Luk. Dr. Luk. Thank you, Chairman. I agree with Dr. Kwok. 24-hour cardiac service, in particular, cardiac catheterization, is very demanding on the medical personnel. With regard to the three other cardiac catheterization theaters, or there will be three, and we will follow the manpower policy of the HA starting from 10 years ago. We asked colleagues to walk an extra mile to help our patients, but we should modernize our arrangement and adopt a standardized manpower compensation arrangement. So in the future, there will be a separate roster, duty roster. In fact, they have asked for that, and that is also fair to the patients. You don't want a doctor who has worked for 30 hours on ends and still has to treat the patients. A simple answer, please. In Hong Kong, there are 4 hospitals providing the service, and the 4 hospitals are discussing this. If resources are available by 2019 or 2020, they will introduce a service. They will cover each other. Yes, indeed. What about the emergency service of OLMH? There are other HA facilities providing 24-hour GOPC. Thank you, Dr. Kwok. According to my understanding, there is no similar design, though in the past there was. Yes, there was in Fanling. Now, because of integration of service And because of demand for safety and also demand on medical service, we reorganize medical service, and there is no such arrangement now. But we are happy to consider the increase in number of quota within the time slot and also extending of hour of service. We are open on this. So my understanding is correct with regard to OLMH, whether it's pre-development or post-redevelopment, the arrangements will be made to meet the needs of the people, and there is room for discussion and review. I've already said that we will end at 11:15. Several members are in the line. They want to ask questions, and after they finish their questions, I will put the proposals in the paper to vote, and the 4 items in the paper that are not controversial will be voted together, and then the OLMH proposal will be voted separately. If members want to ask more questions, then we cannot put this to the vote. I hope that we can make good use of the time available, and I believe you all support the upgrading of public health services in Hong Kong. 3 members, Mr. Wilson O, your 3rd round, Ms. Ho Kai Ming, your 3rd round, and Mr. Jeremy Tam also your 3rd round. And 2 members who have asked to speak, they are Mr. Wu Chi-wai and Dr. Helena Wong, but they are not present. They are not in this chamber. Well, Mr. O, I just want to inform the administration that there are 420,000 people living in Wong Tai Sin. In the coming 20 years, population will grow. I want to stress that the increase in percentage is 34%. As for the usage of GOPC, 140,000 per year, and then special SPOC, 60,000. We don't ask you to provide service now. We ask you to actively consider this.
Because we don't have a crystal ball, we can't predict the future. But you need to reassure Wong Tai Sin residents. You need to allay their concerns and address the concerns of members from various political parties. Why can't you do that? Second point, I'd like to have information from you. According to the paper, after NAH is commissioned, I don't know whether this understanding is correct. The evening clinic will be scrapped. Do you know the Wong Tai Sin DC is aware of this? Under Secretary. Thank you, Mr. Orr. We keep all options open in exploring different service options and arrangements so as to make sure that residents in Wong Tai Sin get the services they need. About the temporary arrangement of extending the service hours of evening clinic from 10 to midnight, well, the evening GOPC service will remain, and the number of quotas will also increase. Next, Mr. James Toh, 4 minutes. My comment is this. Well, many members have touched upon the OLMH, and I'm not going to repeat that because I also heard your response. My take is this. You need to maximize the use of resources so that it is efficient, so that A&E services can be made available to a wider scope of patients. But I understand your point. Let's say for certain locations, it takes so and so minutes to reach the location by ambulance. At the end, you need to give us a performance pledge, and you need to honor the pledge. Say for you can also say 60% of cases meets the performance pledge in other districts, but not in Wong Tai Sin. In Wong Tai Sin, you just barely meet the time pledged, and by then people may say that it's not fair, although you're still able to meet the target. But why is it that for those living in Mongkok, patients can reach the hospital in 4.5 minutes or 5 minutes, but not in our district? So although I understand your position, please try to think about our suggestions as much as possible, because after all, you'll be held accountable in the future, and you may be asked to extend service hours anyway. Well, I mean, a family member passed away recently in Kwong, and I'm familiar with the environment there because my family member stayed there for a long time. I want to reiterate that there must be an underground connection. I understand that the Kwong Hospital and the government both agreed that such connection should be provided. The MTRCL likewise also agrees that they will try the best. But if in the end nothing is done, I will only go after the secretary, not the MTRCL or the hospital. So as a Yau Tse Mong district councillor, I'm telling you, secretary, that you should make sure that it happens. There will be questions, say who foots the bill and how costs are calculated. I don't think it entails a great sum of money, but just in case if there are hiccups, let's say if further study is required to provide the connection, then it will be dereliction on part of you, secretary. About the connection to Kwong Hospital, in fact, together with MTRCL, Transport and Housing Bureau, and Kwong Hospital, we convened an interdepartmental meeting, and we're looking into this matter. And about Mr. James Toll's views, I think the Secretary has heard you loud and clear. No, it is not just a study. Don't look into it. You must do it. Because in the end, if this is not implemented, the government will need to bear the brunt. I think space has been reserved for that in the main building. Chairman, don't just tell me that that is my request. Right, your request is clear. I really want to put this item to a vote today. I need to draw a line. Mr. Wu Chi-wai, Dr. Helena Wong, Mr. Ho Kai-ming, and Mr. Jeremy Tam. I withdraw my question. All right? So we'll put it to a vote after that. We'll try to do that. I already explained. For the 4 other items not very controversial, they will be put to a vote. And then for the OLMH, because of the controversy, it will be separated in the voting process. Mr. Wu Chi-wai. Well, very briefly, we agree that for the 5 hospitals, the project should be kick-started as soon as possible. You're still at the preparation stage. I hope that in the planning process you can incorporate our views, so that when you apply for funding for the main works, you can have our support. Third point, number of beds is on the low side, because you have adopted the standard spatial requirement of 9 square meters between beds. For Kwong Hospital, it's 7.5 square meters. I don't know whether it has to do with manpower as well. Or by choosing a different spatial standard, you may need to provide different level of resources. If the OLMH is comparable to Kwong Hospital, there should be more beds, more nursing staff to cope with the situation. If it is a community hospital, I think that you should provide round-the-clock A&E service for the sake of stabilizing the condition of patients, because for elderly patients in the district, we need mostly treatment for bone fractures and chronic diseases. So I think that you can provide the maximum help if you could provide round-the-clock A&E service. And I hope that you can give us an account before the item is submitted to the FC. I hope members will agree if we go beyond 10:45 to complete the voting procedure. Mr. Ho Kai Ming, 2 minutes. Please be succinct. We need to emphasize once again that we'd like to see the redevelopment of OLMH, but the problem is just half-baked. You are far from meeting the needs of the public. Even at this planning stage, the administration is saying no to our requests already, and that is why we're so disappointed. We all want to improve the service of OLMH. In Wong Tai Sin, we have primary healthcare centers. So would the Bureau give us an undertaking that for these health centers, they will also be open in the evenings? Because if the evening service in Wong Tai Sin is to be scrapped after NAH is commenced, it will be very unfair, inconvenient for Wong Tai Sin residents. Can you give us this undertaking? I want to emphasize, first of all, after OLMH is redeveloped and even after NAH is commissioned, we have no plan to scrap the evening service of Wong Tai Sin, but then it will only be open until 10. After NAH is commissioned, the service hours will go back to 10. Well, that's the standard hour, 10 p.m. But the pilot scheme, as a temporary measure, is that we'll extend the service hours to midnight, and then we'll gauge the service needs to see if we will continue with the scheme. We're not suggesting that the whole of the evening will be scrapped. What about health centers? We'll look into that, and we'll also need to collect views from different districts, because it's a territory-wide scheme. So that includes Wong Tai Sin District Council. I've also received a motion moved without notice under 32 of the ROP from Mr. Ray Chan. I think we need to spend a little bit of time on it. I think if we go slightly beyond 10:45, we should be able to deal with the motions under 32A. Mr. Jeremy Tam and Ms. Wilson Oh. Mr. Tam, please be as succinct as possible. Give me back a few seconds. First question. It's 16,000 square meters at the moment for 292 beds. Question. If we add beds in the future, how many more beds can be added under this plan? I'm not suggesting you should add the beds right now. You have 292 after redevelopment, but then in future, if you want to have more beds, how many more can you add? Do you have the flexibility to add more beds? We'll be able to answer that. According to the feasibility study, 16,000 square meters is the maximum. If we provide additional beds, we need to remove some facilities. No, I'm not suggesting that there should be more beds at the moment, 16,000 square meters. How many additional beds? Of course, it is not desirable. It may not be up to standard. I think Mr. Lee understands your question. Is it possible to add more beds? I think that's his question. I think another assessment will have to be conducted. But that's unreasonable. You should know it. According to the existing standards and existing plan, that's the figure you come up. Mr. Lee, right? Please let him answer. Under Secretary. Well, we're adopting a design where the space between beds are wider, and we come up with a figure 292 beds. What's the minimum? Mr. Wuchiwai mentioned 9 square meters. What's the minimum standard? Response? Chairman, let me explain. Well, it's progress. Well, originally the standard approved by the government was 6.5 square meters. It's been used for decades, and then we strived to increase it to 7.5 square meters for Kwong Hospital, and for Kai-Tak we further increased the space to 9 square meters. So there is no set standard. You just discussed with the government, is that right? The existing standard is 9 square meters. Mr. Wilson, last one. Chairman, I'd like to ask the administration once again whether you can promise the public to tackle the issues about OLMH so that you have round-the-clock A&E services. Quick answer, please. I think they've already answered. I want the Secretary to answer once again. We'll actively look into how we can increase service capacity to meet the needs in terms of extending the hours or other options to enhance capacity. We will discuss it. Mr. Ray Chen has a motion moved without notice under 32A. Please put it on the screen. I think it's part of our discussion about extension of service hours of the OLMH to 12 midnight. Just now, Undersecretary already answered that even after NAH is commissioned, the scheme will not be scrapped at once. It will be subject to review. We need to first of all decide whether the motion should be dealt with. Let's vote on it. If you think that we should deal with the motion, we will start another debate. No debate needed. We've already discussed it. So please vote on it. Should we deal with the motion moved without notice? Those in favor, please raise your hands. How many? Eight. 9. Those against? 1. Abstentions? So it will be dealt with. Well, if Mr. Ray Chan thinks we can spare another debate, those in favor of the motion, please raise your hands. (13) Those against? Please raise your hands. Abstentions? Raise your hands. So the motion's endorsed. We're going to vote on the paper. 4 items. Redevelopment of QMH Phase 1, NAH at Kai-Tak, and redevelopment of Kwong Hospital, and redevelopment of Grantham Hospital Phase 1. All 4 papers. With those in favor, please raise your hands.
全部數數啦。係鄭麗希都舉手。
Okay, Mr. Abraham Sheikh, you're just in time. Okay, unanimously agreed. So the 4 items are endorsed. Then redevelopment of OLMH. Those in favor, please raise their hands. Those in favor, please raise their hands. Redevelopment of OLMH. 12. Those against? Hands steady. 2. Abstention? 1. So the motion is also, or the proposal is endorsed. We have completed the discussion of this item. In May, this proposal will put before the FC. Do members want the project to be separately voted? No. Okay, the next meeting is the 9th of May, 8:30 a.m. Please come punctually. Thank you very much for joining this heated discussion. Meeting is now adjourned.